dealing with the disease, whilst meeting all the 6 key WHO guidelines on the most effective ways of combating the pandemic. Even though it may be said that the number of our infections is still relatively low, if we act now, purposefully, we have a chance of preventing an escalation of our numbers. So, effective 1 a.m. on Monday, 30th March, some 48 hours from now, I have imposed, pursuant to the powers granted the President of the Republic under the Imposition of Restrictions Act, 2020 Act 1012, restrictions on movement of persons in the Greater Accra Metropolitan Area, GAMA, which includes Awutu Senya East Municipality, and the Greater Kumasi Metropolitan Area and contiguous districts for a period of 2 weeks, subject to review. It'll give us the opportunity to try to halt the spread of the virus and scale up effectively contact tracing of persons who have come into contact with infected persons, test them for the virus, and if necessary, quarantine and isolate them for treatment should they prove to have the virus. In Greater Accra, the following areas will be affected: Accra Metropolis, Tema Metropolis, Tema West Municipality, Lejokuku Municipality, Crowell Municipality, Adentan Municipality, Ashiamai Municipality, La Nkwantanai Medina Municipality, La Dade Kotokpon Municipality, Okakwe North Municipality, Ablekuma North Municipality, Ablekuma West Municipality, Ablekuma Central Municipality, Ayawaso East Municipality, Ayawaso North Municipality, Ayawaso West Municipality, Ayawaso Central Municipality, Gan West Municipality, Gan North Municipality, Gan Central Municipality, Gan South Municipality, Gan East Municipality, Kole Klote Municipality, Wejagbawe Municipality, Bon Katamanso Municipality, and the Awutu Senya East Municipality. In the Greater Kumasi Metropolitan Area and contiguous districts, the following areas are affected: Kumasi Metropolis, Asokwa Municipality, Swami Municipality, Old Tafo Municipality, Oforikro Municipality, Asokore Mampo Municipality, Kwadaso Municipality, Echiman Webieja Municipality, Kwabre East Municipality, Ejeso Municipality, Efija Kwabre South District, Bosomche District, Echima Kwanwoma District, and Echima Webiaja North District. This, in essence, means that everyone resident in these areas must stay at home for the next 2 weeks. However, if you must go out, it must only be to get essential items such as food, medicine, water, undertake banking transactions, or to use public toilet facilities. But as much as possible, stay at home. There shall be during this period no intercity movement of vehicles and aircraft for private or commercial purposes for the areas of the restrictive measures, except for vehicles and aircrafts providing essential services and those carrying cargo. Riders of motorbikes are not allowed to carry any additional person, and all intracity passenger vehicles, such as trotros and taxis, must reduce the number of passengers in order to observe appropriate social distancing and hygiene protocols. Additionally, all commercial vehicle stations shall observe appropriate hygiene protocols and social distancing. The Ministry of Transport has engaged the transport operators and unions in this regard. The Ministry of Local Government and Rural Development has also engaged with the metropolitan, municipal, and district assemblies and the leaders of the market associations in the country to make satisfactory arrangements about the operations of the markets that ensure observance of social distancing and enhanced hygiene protocols. In any event, only persons involved in the food value chain can operate in the markets during this period. Individuals and institutions providing the following services shall be exempted from the restrictions: members of the executive, legislature, and the judiciary. Production, distribution, and marketing of food, beverages, pharmaceuticals, medicine, paper, and plastic packages. Environmental and sanitation activities. Staff of VALCO, road and railway construction workers, mining workers, fisherfolk, members of the security agencies assigned lawful duties, staff of electricity, water, telecommunications, e-commerce, and digital service providers, and staff of fuel stations. Fellow Ghanaians, to accelerate the contact tracing process and ensure we curtail the spread of the virus in the shortest time, we will use the military and police to assist health authorities to expedite the process. We'll also pursue a policy of testing all contacts of people tested positive. The affected areas, and indeed all other regions, have earmarked designated isolation and treatment centers for the management of suspected and confirmed cases, as well as the selection of facilities for mandatory quarantine is being carried out. An intensive public health education and community awareness on social distancing and hand washing will be carried out. It is very important that we protect all healthcare providers with personal protective equipment to make sure that they do not contract the virus in the process of protecting our lives. Government has therefore taken delivery of additional PPEs, and more are being procured. Distribution of 17,000 coveralls, 350,000 masks, 17,000 goggles, 2,400 non-contact thermometers, 350,000 gloves, 25,000 sanitizers, and 30,000 test kits are ongoing for healthcare personnel and those undertaking contact tracing and testing. We're recruiting 1,000 community health workers and an additional 1,000 volunteers to help in this endeavor. 100 pickup vehicles and 2,500 tablets have been mobilized for the exercise. Fellow Ghanaians, I'm urging all of you to bear with these additional measures. They are being done in the interest of all of us. They are hopefully only for a short while. These additional measures, together with those earlier announced, are what will help us defeat the virus. And we must be united in our determination and efforts to overcome this challenge. This certainly is not the time for politicking or the display of partisanship. The virus does not care which party you belong to. Neither is it, as we have seen, a respecter of persons. The enemy is the virus and not each other. As I've stated in my earlier broadcasts, all the measures I have announced tonight will be subject to constant review. Fellow Ghanaians, we are in this together, and government will stand by you. We are aware that there will be discomfort and difficulties for all of us over the next couple of weeks. As a responsive government, we will continue to implement bold measures to mitigate the impact of the coronavirus on businesses and households and ensure that job losses are minimized. The Minister for Finance has been directed by me to prepare for approval by Parliament a coronavirus alleviation program to address the disruption in economic activities, the hardship of our people, and to rescue and revitalize our industries. He will then immediately make available a minimum of 1 billion cedis to households and businesses, particularly small and medium-scale enterprises. The commercial banks are, in addition, responding to the Bank of Ghana's 1.5% decrease in the policy rate and 2% in reserve requirement with a 3 billion cedi facility to support industry, especially in the pharmaceutical, hospitality, service, and manufacturing sectors. We're providing additional relief, such as extension of the tax filing date from April to June, a 2% reduction of interest rates by banks, effective 1st April 2020, the granting by the banks of a 6-month moratorium of principal repayments to entities in the airline and hospitality industries, i.e. hotels, restaurants, car rentals, food vendors, taxis, and Uber operators. All other sector